The Covid-19 Pandemic, a Global Chronicle. Origins and Early Spread. In late December 2019, health officials in Wuhan, China began investigating clusters of pneumonia cases with unknown causes. By January 7, 2020, Chinese authorities identified a novel coronavirus, initially named 2019 COVID and later designated SARS-CoV-2, as the causative agent. The disease it caused would soon be known as Covid-19. The first officially reported death occurred on January 11, 2020, in Wuhan. A 61-year-old man who had frequented the Wuhan seafood wholesale market, initially suspected as a point of origin. By January 23, with cases exceeding 500 and deaths reaching 17, Chinese authorities took the unprecedented step of placing Wuhan, a city of 11 million people, under lockdown. The virus, however, had already begun its global journey. On January 13, Thailand reported the first case outside China, a traveler from Wuhan. By the end of January, cases had appeared in 19 countries across Asia, Europe, North America, and Australia. Global Emergency and Pandemic Declaration. On January 30, 2020, with 7,818 confirmed cases across 18 countries, the World Health Organization, WHO, declared a public health emergency of international concern. The following month saw rapid escalation, with South Korea, Iran, and Italy emerging as new epicenters outside China. By March 11, 2020, with over 118,000 cases in 114 countries and 4,291 deaths, WHO Director General Dr. Tedros Adhanom Ghebreyesus made the grave announcement. We have therefore made the assessment that COVID-19 can be characterized as a pandemic. The first wave, March-June 2020. The first wave crashed over the world with devastating force. By mid-March, Europe had become the epicenter of the pandemic, with Italy reporting over 1,000 deaths by March 19. New York City emerged as the American epicenter, with hospitals overwhelmed by April. Daily death tolls in the hardest-hit regions reached staggering heights. Italy reported 919 deaths on March 27, while the United States reported over 2,700 deaths on April 15. As the virus swept across continents, governments implemented unprecedented measures. Nearly 4 billion people worldwide were under some form of lockdown by early April. International borders closed, with air travel dropping by over 90%. Schools and businesses shuttered, creating the largest disruption to education in history. Healthcare systems strained beyond capacity, with field hospitals established in parks and convention centers. By June 2020, the virus had reached over 210 countries and territories. Global confirmed cases exceeded 10 million, with over 500,000 deaths. Brazil and India emerged as new hotspots, while Europe began tentatively reopening after suppressing its first wave. Scientific response and vaccine development. The scientific response to COVID-19 unfolded at unprecedented speed. Within weeks of the outbreak, Chinese scientists published the viral genome, enabling researchers worldwide to begin developing diagnostic tests and potential treatments. Clinical trials for treatments began almost immediately, with remdesivir showing modest benefits and dexamethasone reducing mortality in severely ill patients. However, the race for effective vaccines became the primary scientific focus. Operation Warp Speed in the United States and similar initiatives elsewhere compressed vaccine development timelines from years to months. By December 2020, less than a year after the virus was identified, the first highly effective mRNA vaccines from Pfizer-BioNTech and Moderna received emergency authorization, followed by viral vector vaccines from AstraZeneca and Johnson & Johnson. Subsequent waves and variants. As 2020 progressed into autumn and winter, second waves hit many regions that had successfully suppressed initial outbreaks. In late 2020, the identification of the Alpha variant, Wuhan.17, in the United Kingdom heralded a new phase of the pandemic, viral evolution producing more transmissible variants. 2021 brought more devastating waves. The Delta variant, first identified in India, drove catastrophic outbreaks across South Asia, with India recording over 400,000 daily cases and 4,000 daily deaths at its peak in May 2021. Delta subsequently became globally dominant, causing surges even in highly vaccinated populations. In November 2021, a highly mutated Omicron variant emerged in South Africa, causing unprecedented case numbers, but proportionally fewer severe outcomes. Global inequities. The pandemic laid bare and exacerbated existing global inequities. While wealthy nations secured vaccine supplies and achieved high vaccination rates by mid-2021, many low-income countries had vaccinated less than 1% of their populations by that time. The economic impact was similarly uneven. The International Monetary Fund estimated that advanced economies contracted by approximately 4.7% in 2020, while emerging markets and developing economies, excluding China, contracted by 5%. However, recovery trajectories diverged sharply, with advanced economies rebounding quickly while many developing nations faced prolonged economic damage. Social and political dimensions. The pandemic transformed into more than a health crisis. It became a defining social and political event. Government responses varied dramatically. Some East Asian democracies like South Korea, Taiwan, and Japan achieved relatively low death rates through testing, contact tracing, and targeted interventions. China maintained a strict zero-COVID policy until late 2022. Different Western democracies adopted varying approaches, from Sweden's initial limited restrictions to Australia's elimination strategy. Political polarization intensified around pandemic measures in many countries. Masks, vaccines, and lockdowns became political symbols rather than public health tools in some regions, complicating response efforts. Long-term impact. By October 2023, the official global death toll had surpassed 6.9 million, though excess mortality studies suggested the true number could be 2 to 4 times higher. Nearly every country on Earth had reported cases, making it the most geographically widespread pandemic in history. The pandemic's ripple effects continue to shape our world. Healthcare systems face backlogs of delayed care and surging mental health crises. Educational disruptions have created learning deficits that may persist for years. Remote work has transformed employment practices, urban centers, and commercial real estate. Supply chain vulnerabilities exposed during the pandemic have driven economic restructuring. Public health infrastructure has been strengthened in many regions, though pandemic fatigue has complicated ongoing prevention efforts. A changed world. The COVID-19 pandemic marks a clear dividing line in 21st century history. A global inflection point that exposed vulnerabilities, accelerated changes, and forced a revaluation of priorities across societies. Its legacy includes not only the millions lost but also transformed institutions, technologies, relationships, and perspectives on global health security. While the acute emergency phase has ended, the virus continues to evolve and circulate. COVID-19 has joined the roster of endemic human diseases, requiring ongoing vigilance and adaptation as the world continues to process the lessons of this historic global crisis.
Legendary Time Tales.